Hello again. This is Dr. Jerry Bly, a medical doctor for almost 50 years, and I've been talking recently about sleep. I was going to discuss some natural ways to sleep. Last time we talked about relaxation techniques, and let's talk about some other natural supplements. Time before that, we discussed melatonin, and melatonin can be bought as a supplement and very, very helpful to make one sleep. The dose that is used varies with age. The younger the person, the less that is needed. So if someone is 20 years old, they may need 5 or 7 milligrams of melatonin. If they're 50 years old, they may need 15 milligrams. By the time they're 70, they need 20 milligrams. Melatonin comes in various sizes, 0.3, 0.5, 1, but also comes in 5 and 10 milligrams. So get the largest size. The time to take it is sometimes at bedtime, but even better is at supper time. It doesn't really make people sleepy per se, but defines their daytime, nighttime cycle. So taken several hours before bedtime, best with supper, it does enhance sleep. So a 50-year-old would take 15 milligrams at supper time and then just go to bed. Now, one cannot overdose with melatonin. I know I have folks that tell me that when they take melatonin, they have bad dreams. It's true, but if you might remember from when I first mentioned that we are obligated to do 4 dreams a night, 4 episodes of REM sleep. And if one was deprived of good sleep with good REM sleep, when they take their melatonin and first get REM sleep, they over REM, they make up for lost time, and they have vivid dreams. But after several days, this will get better and better. One cannot overdose on melatonin because in itself, it is an antioxidant and it's been shown to dilate blood vessels. There's melatonin receptors on the coronaries, and it is a supplement that thwarts cardiovascular disease. So that's melatonin. If I had to pick out another drug, it may be vitamin B3. That is niacin. And I like niacinamide, not nicotinic acid, not the flushing type, but niacinamide. And the dose of that would be somewhere between 1 and 2,000 milligrams a day, and that's usually taken in the evening. Another very, very inexpensive and has multi-use is magnesium. I do recommend a magnesium chelate. A chelate is the magnesium as a metal and an organic ion, such as citrate, picolinate, aspartate, rather than magnesium oxide, which is non-absorbed, magnesium sulfate, which is Epsom salts that cause diarrhea, and of course magnesium hydroxide, which is milk of magnesium, and is given to help constipation. So magnesium is a super natural way to get sleep. The dose of magnesium citrate, and the product that I like is Peter Gillam's Calm. 3 teaspoons, and it comes in various flavors, lime, orange, berry, taken in the evening time does promote a good sleep. L-theanine. L-theanine is in tea, but tea also has caffeine, which may hinder rather than help sleep. 200 to 300 milligrams at bedtime will ensure a good night's sleep. There is a natural neurotransmitter called serotonin. 5-HTP is the forerunner of serotonin, and an individual can take 5-HTP as little as 100 milligrams, as much as 300 milligrams, about an hour before sleep, and this will make the natural serotonin and ensure a good night's sleep. Another natural thing that one can use is GABA, G-A-B-A, gamma aminobutyric acid, and doses of 750 to 1,500 milligrams, usually taken in the late afternoon or the evening, does help sleep. Other things that can be used: German chamomile, skullcap, hops, DHA, that's the omega-3, progesterone, passion flower, valerian root, kava kava, and there's a Bach remedy, B-A-C-H, called Rescue Remedy, that taken through 3 or 4 drops under the tongue as one lays down does help people to get a good night's sleep. So you have natural things, and next time we'll talk about medications that doctors use.